Fluid overload is a common problem that impacts the morbidity and mortality of our pediatric patients. Several clinical scenarios and several different abnormalities and pathophysiologic systems lead to fluid overload. So in pediatrics, we see different types of syndromes that are associated with fluid overload. Certainly, if you've worked in the cardiac critical care arena in pediatrics, you've seen many patients who undergo pediatric heart surgery who end up having fluid overload. We know that kidney disease could cause a backup of fluids. It's very common in the bone marrow transplant population with microvascular disease and hepatic congestion. We've all seen it in patients with sepsis. I think that cumulative fluid overload needs to be trended. It needs to be monitored very closely. It needs to be reported in morning rounds like any other vital sign that we have. If you're not achieving your fluid balance goal, I think it's appropriate to start to begin this ultrafiltration process. And like all other interventions, we use this when we believe that the natural course of events are more likely to lead to harm in our patients than the likelihood of harm from the intervention. And so I want to talk a little bit about Aquadex Machine. It's very simple concept, and it's for those of you guys who've done any type of extracorporeal therapy, you'll find that this is a really, really simple machine. Aquapheresis, I believe, is a safe and effective therapy in patients who weigh 20 kilos and have fluid overload, and they can complement your toolkit. Not every patient with fluid overload necessarily needs aquapheresis. There's some that are going to be fine with improving medical management and diuretics and some fluid restriction. But I think it's important to have in your toolkit to kind of help you take care of your patients.